Providing clinical outcome data for patients is important for a couple of reasons. Number one, we're in a business that has a little bit of back patting in it. Every neurosurgeon that you're going to meet is going to tell you that their outcomes are fantastic. I don't know many neurosurgeons who actually follow their outcomes. They don't have anything printed. They haven't logged anything over their years of practice. It's their opinion. And that's fine, and it may be accurate. But if you have someone who's collected data, including the complications on every patient that they've ever operated on, you've taken away that personal opinion of it and created the science. If you can show a patient that you've done 2,000 of a particular procedure, and here's how all of those patients have done, and compare that to national outcomes, and show them that the outcomes in your own practice far exceed what national outcomes would suggest, that earns confidence from those patients and helps them make a good decision that they're in a good place for treatment. I think if we could provide that for every opportunity that a patient has, whether it's surgical or not, patients would be better consumers. We don't want to sell anything to a patient. We don't want to talk anyone into a procedure. Our job is not to sell surgery. Our job is to provide a service of education. Until we have that patient in the operating room, our job is to be an educator, a detective and an educator. Once we figure out what the diagnosis is, we have to be able to communicate that in whatever level of education our patients require and their families to help them understand exactly what's wrong and what's needed to make it right. Once we perform the surgery, then there's technical skill, there's an ability that comes in, and that's why you want to see the person who's tracked their outcomes and shown that not only do they have great successes, but they have very few complications.